Thank you. This is their chart. All right, thank you so much. Take a look here. Would you mind sending them in? Thank you. Hi, sweetheart. Welcome in. It's good to see you again, but I'm sorry because it looks like you're having some headaches. Okay, you're just here for kind of a full body exam. See if we can figure those out as well. Okay. All right, give me one moment here. Review your symptoms. Can you tell me about these headaches? I'm so sorry. I worked a double shift last night. I was on call, so a little bit sleepy, but it was pretty crazy. I worked in the ER. Yeah, I've got some fun stories. Okay, so these headaches. Okay, what would you rate them on a scale of 1 to 10 in intensity? Okay. A 7 is, it's significant. How often are you having these headaches? Well, if you're having them once to twice a day, like I said, that's pretty significant and it's probably really frustrating. And I'm assuming it really kind of interrupts your day and makes it kind of a struggle, especially if you're working. That would be really, really frustrating. Yeah. Okay, so did you bring in any medications for me? You did. Oh, lovely. So we've got 3. Okay. Let's see. Okay. Write these down here. Give me one moment. Okay. So I'm just going to take down these medications and just the details, how often you're taking them. Once a day on this one, and what's that? 10 milligrams, okay. And number 2, we've got. Got it. Write that down. And let's see. How long have you been on these 2? Okay. And we're taking both of these in the morning. That one was. Okay. The last one. Okay. All right. That one's at lunchtime. Oh, breakfast and lunchtime. All right. So the reason I like to have you bring any new medications in is just so that way I can take them down. You can have these back. Just so that way I can take them down, and if any of the side effects are headaches or something, maybe that's what's causing it. I'm not sure. I'll have a nurse look those up. Okay. All right, thank you so much for doing that and bringing those in. That's really going to be helpful in ruling that out. So I'm going to set this right there, and that nurse will come in and help me out with that. I'm just going to put my gloves on. So as I said, we're going to be doing a full body exam today. Okay. Hi. Yes, I just need those medications. Would you be able to see if headaches are a side effect? Pretty more like migraines. Yeah. Thank you so much. All right. First things first here. I'm going to do some of the basics. I'm going to take your temperature here. Okay. Ready? Okay. Perfect. So you do not have a temperature, which is a very good sign. Okay, set that aside here. Get my stethoscope out. And I'm just gonna listen to your heart here. Okay. Sounds normal. Can you take a deep breath in for me? And out. Great, now here. Okay, last one. Alright. Now I'm just going to set this on your back. Deep breath in. Alright. Now I'm just going to get a heart rate here, so I'm just going to listen. Okay. Alright. So, heart rate is normal, which is a very, very good sign. Okay, and did the nurse do your blood pressure? Yes, okay. Blood pressure was normal. Great, so that's good. So we don't need to mess with that at all. All right. Let me take a look in your ears. Are you having any pain at all? Any loss of hearing? No. Any irritation? Sort of feeling of pressure, like your ears need to pop? No, okay. Alright, so that ear looks healthy. Let's look at this one. Okay, looking for any redness, cuts, inflammation, things like that. No, okay. So both ears look very healthy, which is a very good sign. Set that aside. Great. Alright. Hi. Thank you. Okay. So you don't think that would be effective? Do your headaches usually occur at a certain time of day? Yes, I would say it's probably not that. Okay. Thank you. We will rule that out. Okay. So we know it's not any of your medications. Let's continue on with the exam and we'll just see if anything pops up, okay? Alright. Let's take a look at the eyes, right? First, I'm just going to do an overall exam and just look at the health of the eyes, okay? So just look straight ahead. So, just looking at each eye individually. Sorry, I know it's a bright light. I'm just going to kind of pull your eyelids down and up. Just make sure that's healthy. So we're just looking for redness, yellowing. Okay. Alright. When was the last time you went to the eye doctor? Okay. So these contacts are up to date. Good. Okay. I'm just going to check your dilation now. So I'm going to cover this eye. I want you to look at my nose, alright? Just making sure that this is working how it should. Okay, now let's make sure they're equal and reactive. Keep looking at my nose. I'm just going to do what's called a swing test. Okay. All right. Okay. Normal so far. Healthy, which is really good. All right. Keep looking at my nose. Tell me when you see my fingers coming within your eyesight, okay? Just checking your peripheral vision. Okay? Good. Great. Good. Last one. Okay. So that's working well. Let's use this. Okay. You see this back little sheet? Yeah? Can you read above the green line for me? Great. And below the green line as well. That one is easy. P. Okay. So you're seeing well. Do you have any issues when you take your contacts off? No. Okay. How often do you take them off? Any headaches when you take them off? Okay. Alright. Again, just trying to rule out any cause because we really want to get this figured out for you. So, heart rate was normal. It was at over. Yours were healthy. Eyes look good. Check that off. That. Temperature was 97. Alright. So, let's continue on, alright? I'm going to check your reflexes quick. So, scoot back on your seat so that way your knees just kind of touch the back of the end of the seat. Does that make sense? Okay. Alright, so now just let them kind of tingle and relax, alright? I'm just going to tap your knee. I'm sure you've had this done before. Good. Great. Okay. That is normal as well. Okay. And can you open nice and wide for me? Okay. So I'm just going to look around, look for any cuts. If there's maybe a sign of a cavity that could be causing it, potentially. When was the last time you saw your dentist? A few months ago. 3 months ago. Okay, good. So you're all up to date. That's good. Did you have any cavities back then? Just one. Did they say anything about any potential cavities coming up? Okay. Have you been flossing? No? Okay. Well, your teeth look clean, and throw this away. Your teeth look clean. Your gums look good. Tongue looks good. I'm gonna check just your muscles and their reflexes. I'm gonna keep on with that. So can you stick your tongue out for me? Okay. Can you stick it to the side like that? Okay. Other side. All right. Okay. Now can you scrunch your eyebrows like that for me? Good. All right. Can you put them up? Okay. All right. Let me just feel your jaw muscles here. You haven't fallen recently at all. You couldn't be concussed or anything like that, right? Okay. Mystery, mystery, mystery. Okay. Can you open your mouth for me? Like that. Okay. Close it. Good. Alright, can you open your mouth? And I'm gonna try to push it closed. Resist that. We're gonna see your strength and how healthy that is. Ready? Alright, go. Okay, good. Now we're gonna do the opposite, so close your mouth. Thank you. And I'm gonna try to open it. Ready? Go. Okay, good. Let me just feel around the face. Push your eyebrows up for me. Any issues with smell or taste? Smell and taste is fine. Okay, you would know if that was gone. Yeah. Okay. Interesting. Let me make some notes here. So, normal. Check that, check that, check that. Shoes. Okay. Just about done here. Oh, what happened in the ER last night? Well, I would say the main event was this woman walks in, right? I'm standing there by the front desk where you check in. We kind of had a lull, so I wasn't with the patient. She walks in and she demands to see a doctor. a surgeon. And I say, ma'am, what's wrong? Is there anything I can help you with? Because I didn't, see anything immediately wrong with her. Let's, doctor-patient confidentiality, but let's just call her Karen, okay? So she is demanding to see a doctor. I said, I'm a doctor. How can I help you? And so she holds up her hand right to my face like that. And I was like, I don't see anything. And she kept demanding that I fix her hand. I was like, is it broken? What's going on? And she said she had a cut. So finally I find the cut and I'm like, ma'am, I don't know what you want me to do. I couldn't stitch anything. There's nothing to really stitch. It was very interesting, to say the least. You would actually be surprised how much that happens. Yes. Drama. Okay. Alrighty. Let me feel your shoulders here. Okay. Arms. Okay. Any stomach aches or stomach issues? No. Let me feel your neck as well. Check your lymph nodes. I'm just gonna gently put pressure. Do you have any pain with that? Okay, let me just feel. Okay. Feels normal. You don't have scoliosis, do you? No. Alright, you know what? Let me pull these out. Have you ever had a sleep study? No. Because I'm seeing, now that we've ruled everything out, I'm seeing, how many hours of sleep do you get a night? 5. Wow. 5 hours? Okay. Does it take a long time for you to fall asleep? Yeah. I'm sorry to hear that. That must be really frustrating. How much water are you drinking? Not much. About 1 water bottle a day. Do you know how many ounces that is? Like 16 ounces. Okay. Well, what I want you to do, I want you to start drinking enough water, okay? I want you to have 8-ounce glasses a day if you can. Alright, so about 64 in total. Try carrying your water bottle around with you, refill it throughout the day. Anything above 16 ounces is a win, okay? It's gonna be tough at first, but you will figure it out and you'll make it sort of a routine. So do not be hard on yourself. I'm going to send you to our sleep expert. She is amazing. I've even had to go to her before because I had some problems sleeping as well. Alright, so I want her to take a look at you and see if we can improve your sleep and see if that fixes your headaches, okay? Alright. How's that sound? Is that okay? Alright, if not, we will keep looking. I promise you we will figure this out and get this fixed for you, okay? I'm going to write you a referral. Sleep expert. And make sure you spell your last name right. Okay, I thought I got it, but there's the occasional patient that that I just accidentally spelled their name wrong. Okay. Tear this off for you. Okay. Alrighty, sweetheart. Here's your referral. Okay, so I want you to have a great rest of your day. Please call if there's anything else that we can do for you. Call that sleep expert, and they'll ask for your information. We will call as well, and just give them a heads up, okay? Set up that appointment. I think it'll be a huge help. All right. Thank you for coming in. Thank you for being so patient with